Okay, so get this. Half, like literally half, of EMPs get less than 6 hours of sleep a day. Less than 6. It's kind of mind-blowing when you think about it. You picture EMTs, and it's all sirens and saving lives, which it is, but there's this whole other side to their job we're diving into today. Their own safety and well-being.
Right.
We're looking at some real-deal EMT training materials, and let me tell you, it is fascinating stuff.
Yeah, it's interesting. We always focus on those immediate dangers, the car accidents, the fires, all of that. But the behind-the-scenes stuff, that's what's really eye-opening, right? Infectious diseases, the stress, it all takes a toll.
Yeah, absolutely. And that's all covered in the training, which we'll get into.
It's all part of the job for sure.
So, first up, infectious disease. We're not just talking about the common cold here, are we?
Definitely not.
I mean, the training materials go deep on this stuff.
Yeah?
Like they break down how a sneeze, just a regular sneeze, can spread germs in 2 different ways.
Yeah, it's pretty wild.
2 ways.
You've got those larger droplets, right? Like direct hit. Those don't actually travel very far. But the tiny droplets, those are the sneaky ones. They can hang in the air, like for a surprisingly long time.
Oh, wow.
And that's what we call airborne transmission, which EMTs are facing all the time.
So they could pick up what, like anything from a cold to...
Exactly. From something as simple as a cold to something way more serious.
Wow. Okay, so how do they protect themselves from all that?
Well, it starts with the simplest thing, hand washing.
Of course.
The training stresses this over and over, like it's the most important thing, and for good reason, right?
Right.
It's the easiest and most effective way to stop the spread of germs.
Absolutely.
But then, of course, you've got immunizations. They're required to get the hepatitis B vaccine. It's an OSHA thing. But then the CDC also recommends a whole bunch more, like influenza, MMR, all the big ones.
It's like a suit of armor from the inside out.
Exactly.
But it doesn't stop there, right? We got to talk about the actual literal suit of armor, the PPE.
Oh, yeah. PPE is crucial.
So we all know about masks and gloves, especially after the whole pandemic thing. But for EMTs, it's every day.
Every single day. Part of the uniform.
And they're using it in ways you wouldn't even think about, like they were saying they use like heavy-duty gloves just to clean out the ambulance after a call.
Yeah. You got to contain everything.
And get this, sometimes they even wear leather gloves, like puncture-resistant leather gloves, under their latex gloves.
Yeah, if it's a trauma situation, you never know.
That's intense.
It's about minimizing risk wherever you can. And the training for all this, it's so specific. Like even just taking your gloves off, there's a whole procedure for it.
Really? A whole procedure just for taking gloves off?
Oh, yeah.
Wow.
Skill drill 2-1, they call it. Step 1, you pinch the wrist of one glove and pull it off inside out. So you're basically turning it inside out. Then you take that partially gloved hand, you pinch the outside of the other glove, pull that one off inside out too, and then you grab both gloves with your clean hand, only touching the inside part.
Wow. So it's like this whole...
It's meticulous.
Like a dance. That's impressive.
This is all about safety.
Yeah, I can see that.
Yeah.
Really highlights the level of care that goes into protecting everyone. Okay, but even with all that, this is still a super stressful job. Lives are literally on the line every day. So how do EMTs deal with that kind of pressure?
That's where the whole wellness and resilience thing comes in, which they talk about a lot in the training.
Okay, so break that down for me. What does that even mean in this context when we're talking about EMTs?
So wellness, think of it as being proactive. It's like actively taking care of your health, eating right, exercising, trying to get enough sleep, which the materials acknowledge can be really hard.
Yeah, I bet.
The average EMT, they're getting less than 6 hours a night.
Are you serious? Less than 6?
That's what they're saying. It's a demanding job.
No kidding.
And then there's resilience, which is a little different. It's more like your capacity to deal with the tough stuff, to bounce back from all the difficult things you see.
So wellness is building yourself up, and resilience is being able to handle it when it gets rough.
Exactly. You got it. And the training goes deep on both. They even get into the science of it all, like the general adaptation syndrome.
Oh, yeah, I think I've heard of that. It's that whole thing about how our bodies react to stress, right?
Exactly. So first, there's alarm. That's like the initial jolt, when you're facing some kind of danger. Then your body tries to deal with it, and that's resistance. And then finally, there's recovery.
Makes sense.
But here's the thing. If the stress just keeps coming, which it does for EMTs, you end up exhausted, like totally burned out.
So how do they avoid that? I mean, obviously, they can't just avoid stress altogether.
Right, and that's why the training emphasizes all those healthy habits, like Good diet, regular exercise. They really hammer home the sleep thing, even though it's tough. And then, just as important, those connections outside of work, friends, family, that kind of thing. Having a good support system, it makes a huge difference. And of course, getting professional help if you need it.
Right, there's no shame in that.
Not at all.
So it's all about finding that balance, I guess,
Yeah.
between the job and...
Taking care of yourself. Exactly. And it's not just physical, right? There's a huge emotional component too.
Oh, for sure.
Imagine, I mean, just picture yourself at the scene of a bad car accident. Lights flashing, sirens blaring. It's intense. And that's before you even get to the patients.
That's a really good point. It's easy to forget about that part of it.
People are at their most vulnerable in those moments. And EMTs are dealing with that every day.
It's a lot.
It is. And that's where compassion fatigue can really set in.
Yeah, the training actually talks about that, right? Compassion fatigue.
Yeah, big time. They emphasize how important it is to recognize the signs, both in yourself and your coworkers.
What are some of those signs? I mean, for those of us who aren't EMTs, what should we be looking out for?
Well, they mention things like, being more irritable than usual, having trouble concentrating, withdrawing from people,
Yeah, that makes sense.
even feeling numb, like you're detached from the people you're trying to help.
Like you're just running on empty.
Exactly. It's like your empathy just gets depleted.
Wow.
And that's why having healthy coping mechanisms, a strong support system, it's so crucial.
So how do they deal with all that emotional weight, especially when they're facing these really intense situations? The training actually gives some phrases that EMTs can use to comfort people, right? Like patients and family members.
Yeah, like, I'm so sorry for your loss, or it's okay to be angry, tell me how you're feeling, things like that.
Just being present.
Yeah, basic things, but so important in those moments.
Definitely. And it's not just about the words, right? It's about understanding what people might be going through.
Oh, absolutely. And they talk about the stages of grief, denial, anger, bargaining, all that. It's not always linear. But understanding the stages can be really helpful for supporting people during those times.
Right. There's no right or wrong way to grieve.
Exactly. And the training makes a really important point here. It acknowledges that EMTs are human too. They're not immune to any of this.
Of course not. They see this stuff every day.
Exactly. It's bound to have an impact.
The training also goes over some difficult workplace issues that EMTs might face, right?
Yeah, things like dealing with different cultures, sexual harassment, substance abuse, all those tough topics.
Let's unpack those one by one. So first up, cultural diversity.
Right.
The training mentions that, EMS is becoming more diverse, which is a good thing, but it also presents new challenges.
Definitely. They emphasize how important it is to be aware of different cultural backgrounds and beliefs.
Right, because you're going to encounter all sorts of different people on the job.
Exactly.
Yeah.
It's about being sensitive and respectful, making sure everyone gets the same quality of care no matter who they are or where they come from.
So it sounds like cultural sensitivity is becoming more and more important in EMS.
Absolutely, it's essential.
Okay, now let's talk about the elephant in the room. Sexual harassment. It's a tough topic, but it happens everywhere, and EMS is no exception.
Right.
So how do they address that in the training?
They're very upfront about it. They make it clear that it's not okay. It's never okay. And they talk about having clear policies in place so everyone knows where they stand, and training so people can recognize it and know what to do if it happens.
Creating a safe environment to report it.
Exactly. Everyone deserves to feel safe at work. That's the bottom line.
Absolutely. And then there's the whole substance abuse issue. I mean, we're talking about people's lives here, so the stakes are even higher.
Right. You can't have any impairment when you're responsible for other people's safety.
Absolutely not.
The training is really clear about that. They have a zero tolerance policy for illegal drugs, obviously, but even with prescription medications, they're very cautious.
Rightly so.
It's about making sure everyone is on top of their game.
And speaking of being on top of their game,
Yeah.
we've talked about the mental and emotional demands of the job, but it's physically demanding too.
Oh, yeah.
I mean, they're lifting patients,
Yeah.
often in really difficult situations. It's got to be tough.
Absolutely. And the training stresses that you have to be in good shape.
Makes sense.
It's not just about being strong enough to lift someone. It's about avoiding injury.
Like they even talk about wearing the right shoes so you don't get blisters.
It's all those little things that can make a big difference.
And then there's all the gear, like that turnout gear for fires.
Oh, yeah.
It's intense.
It's heavy, it's hot, but it protects them from a lot. Heat, flames. They even talk about something called a flashover, which sounds terrifying.
Like a flashover.
It's when everything in a room just ignites because the heat gets so intense.
Oh, wow.
It's incredibly dangerous.
So I guess they're not just rushing into any fire they see.
No way. They have to assess the situation, communicate with the firefighters, make sure it's safe before they go anywhere near it.
It's about teamwork,
Yeah, exactly. And the same goes for vehicle crashes, which are another big one for EMTs.
which can be just as dangerous in a different way.
Totally.
What are some of the things they have to watch out for with a crash?
Well, obviously, traffic.
Yeah.
You've got cars whizzing by. Then you've got the vehicles themselves, which might not be stable.
Right?
Down power lines. And then, believe it or not, there's always a risk of violence, either from the people involved in the crash or even just bystanders.
Really? Wow.
Yeah, it can get intense.
So how do they handle that?
Well, the training emphasizes wearing protective gear, like helmets, especially if there's anything that could fall on them. They need to be super aware of their surroundings, like are there fluids leaking, sharp objects?
Right.
Even airbags, they're designed to save lives, but if they haven't gone off and they deploy unexpectedly, they can really hurt someone.
Wow. I never thought about that. So scene safety is a huge part of what they're trained to do.
It's a huge part of the job.
They have to assess the situation, figure out what's dangerous,
Yeah.
and take all the precautions to protect themselves and everyone else.
Exactly. And that includes things like making sure they're visible, like if it's dark out, wearing reflective clothing.
Oh, yeah, that makes sense.
It's all about minimizing risk. And sometimes, unfortunately, that risk involves actual violence.
Right, because it's not always accidents and injuries.
Right.
The training actually covers assaults.
Yeah.
Yeah.
Hostage situations, even riots.
Wow. That's the
But-
reality of the job.
So they actually train for how to respond to violence.
They do.
Huh.
It's about being able to identify potential threats, knowing when to call for backup, and
Mhm.
always putting their own safety first.
Right, because they can't help anyone if they're injured.
Exactly. And then there's the really scary stuff like mass casualty events, active shooter situations, that kind of thing.
Right.
And those situations are different. They have to be aware of the overall emergency response, know who's in charge, stay safe until the scene is secure. It's a lot to handle. It really makes you appreciate what these guys and gals do.
Absolutely. It takes a lot of courage to do this job.
Okay, so we've talked about the dangers,
Yeah.
but the training also talks about communication,
Mm.
right? Like how important that is when you're dealing with patients,
Oh, yeah. Communication is key.
especially when it's a really critical situation.
Exactly. They're trained to be honest with patients, but also to offer hope, even in those really tough moments.
Finding that balance.
Yeah, and then there's the whole thing with initial refusal of care, which can be tricky.
Oh, yeah, I bet. What do they do if someone doesn't want help?
They're trained to explain the situation clearly, make sure that the person understands the risks, address any concerns they might have. But at the end of the day, they can't force anyone to accept treatment.
Right, of course not.
And then, of course, you've got the family members who are also going through it.
Oh, yeah, for sure. I didn't even think about that.
Yeah,
It's a lot to deal with.
it is.
And the training also goes over what to do if a patient is a child,
Right.
because that's a whole other set of challenges.
Definitely. Kids have different needs, they get scared more easily.
Right.
They're more vulnerable. So EMTs are trained to be especially sensitive and understanding when they're dealing with children.
I imagine that can be tough.
It can be. Like, they always try to have a parent or guardian there, if possible.
For comfort.
Yeah, for comfort and just to help get consent for treatment and all that.
Right, because the child
Mhm.
can't always
Exactly.
consent for themselves.
Yeah.
And sometimes, and I know this is a difficult topic,
Yeah.
but sometimes the worst happens.
Right.
The training talks about that too.
Mm.
Like how to deal with the death of a child, which is just,
It's every parent's worst nightmare.
exactly, it's just heartbreaking. And EMTs are the ones who have to.
Be there.
Yeah.
And it's tough. The training emphasizes the importance of letting the parents guide the interaction, offering
Yes.
support, both practical and emotional. It's a really sensitive situation.
I can't even imagine.
But the training makes it clear that EMTs don't have to handle this alone.
Right.
They talk about reaching out for help, talking to peers, supervisors, mental health professionals.
Being support.
Exactly.
It's huge, having people who get it, who've been there.
Exactly. And they actually have a whole process for this. Critical Incident Stress Management, they call it. CSMM.
Yeah, I was wondering about that. What is that exactly? Is it like group therapy after a really bad call?
It can be. It's designed to help deal with the emotional impact of these traumatic events, which honestly could be a lot of things.
Right.
I mean, it could be a mass casualty event, something huge like that, but it could also be something like, A really bad car accident involving a kid.
It's about processing those tough calls, getting it out.
Exactly. And they talk about having these diffusing sessions, which happen right away, and then debriefing sessions later on.
So diffusing is like immediate, and then debriefing is more.
Yeah, more in depth a little later.
Okay, that makes sense.
And they emphasize that it's not about pointing fingers, like who did what, right or wrong. It's
Yeah.
not about that.
Right, it's not a blame game.
Exactly. It's about processing the emotions, the psychological impact of what happened.
Separating that from the technical stuff?
Exactly. But they also talk about how individual counseling can be really helpful too, especially if someone's not comfortable in a group setting.
Right, everyone's different.
Exactly. Some people need that one-on-one support.
Absolutely. The main thing is there's no shame in getting help, whatever that looks like for you.
100%.
And speaking of taking care of yourself, the training also talks about the importance of regular checkups.
Oh, yeah. Annual health exams for everyone.
So it's not just mental health, it's physical health too.
It's all connected. And they hit all those key points, eating right, exercising, trying to get enough sleep,
Which we know is easier said than done.
yeah, for sure. But it makes a huge difference. And even if you can't get a full 8 hours every night, which, let's face it, most EMTs can't, even those little things, like taking a short nap when you can, it can really help.
Right, every little bit counts.
Exactly. And they talk about finding those things outside of work that help you de-stress, whether it's spending time with family and friends, exercising, whatever works for you.
Yeah, having those outlets is so important.
It's crucial.
Well, this has been an incredible look into the world of EMTs.
It really is fascinating, isn't it?
It is. We've gone from those high-pressure situations, the emergencies themselves, to the challenges of staying healthy and well, both physically and mentally, in a job that is just constant stress.
It's a lot to handle.
It is. And it really makes you appreciate everything they do, all the sacrifices they make.
They're amazing.
They are. So to everyone listening, next time you see an ambulance go by, maybe think about this conversation. Remember, that person behind the wheel, they're not just a driver. They're not just a medical professional. They're dealing with incredibly stressful situations, often putting their own well-being on the line to help others. So yeah, they deserve our gratitude, for sure, but they also deserve our support and understanding. Thanks for joining us for this deep dive, everyone. We'll catch you next time.